الباك تكنيك. الباك technique, a tool making use of public health care through which the nurse during her home visit can perform a nursing procedure with easy and saving time and effort with the end of providing effective nursing care. The public health bag is an essential equipment of the public health nurse which she has to carry out home visiting. It contains basic medication and articles which are necessary for giving care. Principles. The use of bag technique should minimize, if not totally prevent, the spread of infection from individuals to family, hence to community. The bag technique should save time and effort on the part of the nurse on the performance of nursing procedure. The bag technique should not overshadow concern for the patient rather than should show the effectiveness of total care given to an individual or family. Special consideration in the use of the bag. Never put the bag in the floor at any time. Put in your leg when sitting in the home bus. Use the medical aseptic technique, absolute clean, because the inside of the bag is considered clean. Washing the bag with the water and soap from inside and outside every 2 weeks. Put solid equipment on the top of the bag. Check equipment before leaving the center and before leaving the home to make sure you have all equipment. Change the hand towel every visit and washing it. Equipment used in the home must be washed with water and soap and disinfected. Change the apron according to situation. Bottles must be checked and refilled daily. The bag should contain all necessary articles, supplies, and equipment which may be used to answer emergency situation and needs. The bag and its content should be well protected from contact with any articles in the home of the patient. Consider the bag and its content clean. The arrangement of the content of the bag should be the one most convenient to the user to facilitate efficiency and avoid confusion. Hand washing is done as frequently as the situation calls for. Help in minimizing or avoiding contamination of the bag and its content. The bag, when used for communicable case, should be thoroughly cleaned and disinfected before keeping and reusing. Procedure: clean the bag from inside and outside by soap and water. Put the bag on clean and dry surface. Hand washing must be done. The bag consists of 4 sides: far side, near side, right side, left side, and 6 layers arranged from bottom to top and outer pocket. The equipment needs special consideration both in vertical and in separate section. The far side includes 2 thermometer, oral and rectal. The near side includes 2 artery forceps, both vertical to prevent infection. 2 scissors downward to prevent injury. Baby scale. The left side includes any solution such as alcohol, betadine, soluble drops and ointment. The right side includes baby oil, Vaseline jar, adhesive tape, different size of syringe, and 4 safety pins. discuss the four side arrangement the 6 layers. The 6 layers include 2 parts. The first part from the 6 layers include perineal bed and tongue deposition. This is the first part from 6 layers. The second part from 6 layers include meter container, include 2 test tube holder, 2 drawers, measuring tape. This is the second part from the 6 layers. The 5th layers include baby diaper. The 4th layers include muslin bag. Muslin bag included cotton sponge, dry and soaked with alcohol, dressing, disposable gloves, alcohol swab, and baby food and baby stuff. The third layers include upper and plastic bag. The second layers include extra paper bag and safety boots. The first layers include 3 parts. The first part from the first layers include solid equipment such as sphygmomanometer, blood sugar apparatus, stethoscope, and Bernard. This is the first part from the first layers. The second part from the first layers include hand washing equipment, towel, and soap dish. The third layers from the first layers include extra fan fold and plastic lid. After that, the outer pocket include health education media and notes and pencil.